from the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. Here's what we're talking about today.
I literally felt like I was dying from the inside out.
What she thought was an old back injury was far more dangerous. It turns out half of her body wasn't getting the blood it needed. You're about to meet a woman who had her entire aorta replaced and the talented surgeon who saved her. And we'd love your questions, we'd love your comments. They're really the heartbeat of our show. You can send them all to us on Twitter, Facebook, YouTube, or email. Basically, we're everywhere. All those links are right there on your screen. So let's talk about your aorta. It's the biggest artery in your body, and its role is pretty crucial, carrying blood from your heart to everywhere else in your body. That wasn't happening for Julie French. Her aorta was covered with plaque, cutting off the blood supply to her legs with devastating consequences. Julie French barely has words from when she was at her lowest point.
I literally felt like I was dying from the inside out. I could not walk even half a block.
But today, the Topeka woman happily chats about life now and how far she's come.
I feel like I'm 20 years younger now. I mean, I can move like I'm 20 years younger now.
For years, Julie says she lived with a terrible pain in the lower half of her body that kept getting worse. She thought it was because of an old back injury. It would turn out to be something far more sinister.
It was because the bottom half of my body was not getting a blood supply.
A trip to the doctor in Topeka revealed Julie had severe atrial plaque choking off the blood supply to her legs. That doctor referred her to the University of Kansas Health System vascular surgeon, Dr. Kara Hessel.
She's an excellent surgeon.
Because the plaque was so severe, the only solution was surgery, and it would be a big one. Dr. Hessel would perform an aortobifemoral bypass, entirely replacing Julie's aorta all the way down to her groin. As dramatic as that sounds, and the surgery is, Julie says 3 weeks later, she was off all of her pain medication she'd been on for more than a decade, had joined a gym, and had not only ditched her walker, but was back on the treadmill.
The first time I went back to her office after the surgery, she was like, wow, you don't look like the same person that came into my office before. And I told her, I am not the same person that came into your office before. You have completely changed my life.
Wow, we are so pleased to welcome Julie French to our program, along with her vascular surgeon, Dr. Kara Hessel. I can't imagine there are any bigger compliments than a patient telling you that you've changed their life.
Yeah, it's pretty incredible. We're so happy for Julie.
Julie, how are you feeling today?
I feel fabulous.
I love that. You've lived with this for so long. How did you finally discover Dr. Hessel and know that she was the doctor for you?
Well, the surgeon that was supposed to do the surgery took a look at the scans and everything, and he was a little bit too worried about doing it because I had already lost one kidney and the other one was in danger. As a matter of fact, Dr. Hessel told me I was probably going to have dialysis after the surgery, but she's such a great surgeon that I didn't have to have any.
That's pretty amazing. So when you talk about replacing the entire aorta, what are you replacing it with?
So there are different scenarios where we use different materials for it. Sometimes we are able to use a synthetic graft, which actually goes inside of the body and basically replaces the entirety of the aorta. Sometimes, particularly if there's infections, we have to use other materials like donor cadaver artery. And so we sometimes will do that instead.
So what did you use in Julie?
In Julie's case, she didn't have any signs of infection or anything like that, and so we used a material called Gore-Tex, which is actually the same thing that raincoats are made out of.
Yeah, I recognize the ingredient. My winter gloves have Gore-Tex in them. So Julie has a Gore-Tex aorta?
She does, in her belly. Yep.
Wild. So what happens then? What happens to your heart during the surgery?
So most of the time people's heart tolerate things pretty well overall. We do a full cardiac workup before we do any surgery like this. And so when we do the cardiac workup, we ensure that people's hearts can tolerate our surgery, because when we do the surgery, we actually will put a clamp across the aorta, which increases the back pressure on the heart and can cause problems if people have an underlying heart condition. And so we're always very cognizant of that, and we make sure that people can tolerate it before we do surgery.
So for those of us who might have dozed off during science or biology or any sort of anatomy class, can you explain for, I don't know who they'd be talking about, but can you explain for the viewers where your aorta runs?
So your aorta actually comes up out of your chest, and your heart's sitting right here. Your aorta is going to come up this way. It makes a left turn in the chest and then comes down your back right on top of your spine into your abdomen, and then splits in two about the level of your belly button and gives off the arteries to your legs.
And would the fact that it rests on the spine also be what was causing Julie to think it might have been a back injury?
So sometimes people will actually have problems with their back and problems with their aorta. It's something that kind of goes hand in hand sometimes. Okay. They're not necessarily related, but they can happen at the same time, and their symptoms are very similar. And so a lot of people will attribute decreased blood flow to the legs and the pain that it causes to a neurologic cause from the spine. And it's not until somebody actually does a complete pulse exam and some additional studies that they discover, oh wait, this is actually pain that's related to the blood supply and not to the nerves.
How common is the surgery that you performed on Julie? Is this something you do all the time?
So we do it a lot here at the University of Kansas. It's not as common in other locations, particularly in smaller hospitals. We've actually seen a push towards doing what we call endovascular surgery, where you can put stents into the aorta sometimes rather than having to actually replace the aorta. It depends on the patient whether they're a good candidate for the endovascular option or the open option. So in Julie's case, she was a very good candidate for the open surgery because of the extent of her plaque and the fact that it reached all the way up to her kidney arteries and were involving her kidney arteries. We couldn't have really fixed her with stents with that.
Julie, how long had you lived with what you thought was the remnants of an old back injury?
Probably 15 years at least. 15
years. Wow.
Yeah, it gets worse and worse over time. So you kind of, I mean, you notice that it's taking things away from you, but it happens so slowly that you don't really, you're not like, oh no, I can't, do this now. It just kind of happens slowly, and so. But yeah, I couldn't hike anymore. I couldn't even walk to the end of my driveway back without having to sit in because the pain was so bad. I couldn't do anything. So, I mean, basically, I don't know how much it's still working, but.
Yeah. Well, thanks to the surgeon next to me, right? You're walking now.
Yeah.
What would have happened to Julie if she'd waited any longer to come in? I mean, this was 15 years it was brewing.
So she already had some signs of early kidney failure when she came in to see us. She's absolutely correct that she was kind of on her way to potentially needing dialysis, and we were concerned that because of the location of the plaque and where we would have to repair up to, that she would actually require dialysis as an inpatient after surgery, and potentially in the future if we weren't able to salvage her remaining kidney. So there was that possibility, and so that could have been something that would have been a major issue for her. The big thing is that a lot of people actually will experience worsening of their symptoms over time, like what Julie is describing. So it'll start out as something that's not super noticeable or super limiting, where they'll have cramping pain in their thighs or in their calves as they're up and walking. As the disease progresses, the pain gets worse and comes on sooner, and they can't walk the same distance then that they were able to walk. And that progresses over time to the point where then people are having pain at night, or which will wake them up from sleep. They'll have pain in the balls of the feet or in the calves, and that will wake them up from sleep, and that really limits people's day-to-day activities because they're not getting any rest anymore. And then the worst thing that can happen is that wounds can actually develop in the lower extremities, and then which can lead to infection and can lead ultimately to amputation if they're not addressed.
You have Julie's CT scan that you've shared with us, and I want to pull that up so we can take a look at it. I'd love it if you could talk us through through, excuse me, what we're seeing here?
So this is Julie. So the bottom of the screen is her back, the top of the screen is her abdomen. And actually there's a white dot right in the center of the screen where you can actually see the aorta. And see there's like a white rim around it, and then it splits in two right there, and then it's coming down into her legs. There should be bright white that's in the middle of those bright white circles, and that would show the blood supply. Now you can actually start to see that like white that's coming back in, and that is actually where the blood flow has kind of recirculated from other smaller blood vessels around the area of blockages and is actually getting down to her legs. So very small blood vessels that run right on the front of the chest and down the front of the belly, we're actually carrying Julie's entire legs rather than the main blood vessel through her entire belly and through her pelvis.
So do those blood vessels look, can you see that from the outside? Like, does it look bluer or puffier, or is it all internal?
So sometimes people will have enough enlargement of those arteries that you'll actually definitely be able to appreciate it more on a CT scan, like what we just saw. And in some people, they do look more prominent in person as well, yes.
By the time that Julie reached you, was there any other way to help her, or was surgery the only option to save her?
So in most cases, when people come in initially with just that symptom of pain with ambulation, particularly if it's not limiting their lifestyle, if they can go about their daily activities, then our initial step is for medical management. So we'll control their blood pressure, we'll control their cholesterol. If they have diabetes, we try to control their diabetes. If they smoke, we try to get them to quit smoking, and we give support services for that. And then if the disease progresses and they're experiencing more of a lifestyle limiting type of thing where they like have a very difficult time working, they have a difficult time, they have grandkids, they want to interact with their grandkids, they want to get up and move, then sometimes we will consider either an endovascular or a surgical approach to allow them to actually get back to more of a baseline.
Julie, I want to talk to you a little bit more about this because you are such an active person. Your job is also being a caregiver. You help take care of senior citizens, correct?
Yes.
So you're on your feet all day, and you're going 15 years thinking it was a back injury. Can you explain a little bit more about your symptoms? Because so many of us have back pain, and it's alarming to hear that this was the cause of yours.
Yeah, it was, and I would have like numbness, like it was the sciatic nerve. A lot of times, and so I thought it was due to sciatica. And something else that I guess I didn't mention before was I also got to where I could not do anything outside because I couldn't take the heat. If I went out at 7 o'clock in the morning and started weeding, 15 minutes later I would have basically all the symptoms of heat stroke. I would end up throwing up. I'd have to go back inside and go to bed. And my mother can now get me to go out and work out in the yard for like hours, and she's loving that. So,
yeah, she's putting you to work.
she loves, because she loves to have flowers and stuff out there, and all the flower pots and everything. So that's been
it's probably therapeutic.
Yes, it is. Yeah, I like doing it. So.
I want to get to some of our community questions because we're getting some questions from our viewers coming in. Stan wants to know, is replacing the aorta technically considered heart surgery, Dr. Hessel?
In the location that Julie had her surgery, no. But we actually will replace the aorta in other segments up in the heart as it comes out of the heart, and up in the chest for other reasons, whether it is because of severe plaquing or if it's because of like aneurysm or dissection disease. Those segments of the aorta do have to sometimes be replaced as well.
June has a question for Julie. June wants to know, Julie, do you now see a cardiologist and a vascular doctor and a nephrologist? What are all the specialists you have to see now?
I see a cardiologist once a year, and I think I have a couple more visits with Dr. Hessel, and then I think she's probably going to be like, see you later. But and I have my primary.
Got it. Were Julie's symptoms, Dr. Hessel, Sid wants to know if Julie's symptoms were typical.
Yes, they were very typical. So she had initially started out with this cramping pain in her legs, and then it got to the point where she was having such severe pain that she could barely walk at all. And then she actually got to the point where she was then having pain at rest, and that is very common. The first time that Julie came in and saw me in the clinic, what were you using, Julie?
A walker.
She had to use a walker at that point, and she is now, because we were able to restore that blood flow, she is now back to being able to ambulate completely on her own and do all the other things that she wants to do.
So Sid actually had a follow-up question to that. Then how do you know, so many people have back pain, how do you know at what point you need to see a cardiologist or a vascular surgeon if you have back pain?
So it's something to talk about with your primary care doctor, and it's more about leg pain than it is about back pain.
Okay.
The issue is in the abdomen, but everything is always going to be one level lower than where the area of blockage is. So if you have a blockage in your belly, then most people are going to experience the pain either in their hips or in their thighs.
Okay.
If they have blockage in their groin, then they're going to experience pain in their thighs or in their calves. And then if they have blockage in their thighs, then they'll really experience pain in their calves or in their feet, because those are the muscle groups that are being robbed of that blood supply. So anytime that you have pain, you should obviously be talking to your physician about it, especially if it's limiting your activities throughout the course of the day or keeping you awake at night. But the big thing is that primary care physicians are great about doing pulse exams when patients come into the office, particularly patients who have like diabetes or who have a smoking history. A pulse exam. So they'll actually feel the pulses in the groins and in the feet, and then they can get some early studies a lot of the time, which then prompts the referral to someone in my specialty, or sometimes interventional cardiology will be involved, or interventional radiology, folks like us who actually do the interventions for this type of surgery and monitor it over time.
Carl wants to know, should I ask specifically for a pulse exam?
I mean, you can. I think it's a good thing to advocate for yourself. If you have symptoms that are consistent with this, then I don't think it's unreasonable to ask your physician for that. Sure.
Julie, did you want to add something to that?
My physician just looked at my feet, and she sent me to get one, because really they look like a corpse feet. I mean, they didn't have any sores or anything on them, but they were real, like, kind of blue colored, and so she's like, I don't like the way this looks.
Well, you said was it your son or your brother said that you looked like a walking corpse?
My brother said,
by the way, to say that to someone, but
he said you looked like you were 10 minutes from death's door last time I saw you. And I heard his wife in the background, oh my God, Greg, don't say that to her.
But it's a great testament to how you look now. You look fantastic. I've got a question from Jonas. Jonas wants to know how long an aorta replacement lasts. Does this last a lifetime, or will Julie have to need like touch-ups or?
So the goal is for it to be a forever thing.
Okay.
Sometimes things do clot off, and so we do have to watch things over time. So Julie, you had mentioned that you would see me a few more times, but you and I are lifelong friends. You're not getting rid of me. So we always have people come back more often immediately after surgery. So the first 2 years after surgery, people see me pretty frequently, like every 3 to 6 months. Once we get beyond that initial 2 years, then we really just do yearly follow-ups to make sure that there aren't any new issues and that the graft continues to look good.
Dr. Hessel, you talked about, and
I can't take any cholesterol lowering medicine. It causes an anaphylactic reaction. I mean, I try to eat a good diet, but high cholesterol runs in my family, so.
So you got hit with a few different factors that made you vulnerable.
Yeah.
Absolutely.
Emily has a question, and Dr. Hessel, you had talked about wherever the problem is, you'll experience pain lower than that. Emily wants to know if chest pain is ever a symptom of an issue with your aorta.
So sometimes. So there's kind of 2 categories of aortic disease. One is kind of what Julie has, which is like a plaque development, where we have atherosclerotic disease that actually builds up within the artery and can cause narrowing of the artery or even complete obstruction of the artery. So there's no blood flow getting beyond that. The other thing that can sometimes happen is that we can actually develop aneurysms, or we can develop dissections. And so those things actually fall into a little bit different category. And both of those can be a cause of chest pain and something that should prompt an evaluation in an ER.
Jordan has a question for Julie. Jordan wants to know if you had to make any dietary or lifestyle changes. And Jordan writes, changing those things can be daunting.
I did quit smoking.
Cold turkey?
Well,
because that's hard.
It took about 3 weeks. I cut down and then just because I wanted to make sure I quit plenty of time before the surgery. So, and I'm still not smoking. So.
Oh, that's always a good thing to quit smoking. Julie, did you have to take advantage of Dr. Hessel's smoking cessation counseling? How did you do it?
I actually quit before I even met Dr. Hessel because I was scheduled for surgery with a surgeon in Topeka. But then the night before the surgery, he re-looked at the scans and he was just a little too worried that it was a little much for him. So he sent me to Dr. Hessel.
Dan has a question, because you had mentioned that earlier, that the surgeon looked at it and said, I'm not the guy, Dr. Hessel's your surgeon. Did it make you nervous when the first surgeon told you it was too complicated for him?
Not really. And I'm one of those people that likes to, and so I researched Dr. Hessel before I ever met her. And I was like, well, she's very young and very pretty. Right there told me she had to work a lot harder than, a lot of other people to get where she's at. So I thought, yay. But she, looked like she had trained at some, she trained in Chicago, wasn't it? I believe. And
yeah, I was at Ohio State. Yep.
I can see why you want to stay lifelong friends with each other.
Yeah.
It's like a compliment fest.
Right.
Deservedly.
Yeah, she is.
I want to.
The first time I went, she made me feel so comfortable, and she just, took her time, explained everything. I mean, she must have been in there with us like half an hour, 45 minutes, just telling us about the surgery, what it would entail. I mean, because it was like, what, a 7 hour surgery, I think. Something like that. So.
7 hours?
Yeah, I mean, close to that.
So is that a long surgery for you, or is that typical?
It's a longer surgery. Julie's disease was a little bit more extensive than most, and so we had to do some additional workup at her renal arteries. I think, people think that the surgery itself takes the full 7 hours, but really part of it is like getting into the operating room and getting anesthesia and getting positioned and then waking up and going over to the ICU and everything like that. But I just wanted to say too, Julia, like, you really did a lot of the work here. You were commenting on the fact that like you didn't have to go on dialysis, you got out of the hospital quickly, you recovered quickly. The fact that you quit smoking when you did, before we even did all of this, contributed enormously to that. And so cutting back or quitting prior to proceeding with something like this is phenomenal, and I can't commend you enough for being able to do that.
Thank you.
I want to keep you both here because I want some final thoughts from you both, and I want to start with Julie. Julie, as you sit here today, looking incredible, feeling incredible, what do you want our viewers to know about your journey, if maybe they're at the very beginning of their journey with the same thing?
Try to live a healthier life, and it is so worth it to have the surgery. It's a little scary, but I mean, honestly, when I woke up, I was like, yes, I made it, but I was pretty sure I was going to make it. But it has completely changed my life. I can do the things I used to be able to do, and without being in pain all the time, life's just better. So
you talked about your dreams being put on hold, and now Dr. Hessel gave you your life back. I want you to share with our viewers, because you shared with me you have some pretty exciting plans coming up that have to do with hiking in the Olympia National Forest.
Yes, my son lives out there close to that, and so we're wanting to go hiking there, and I got to go up with him in his plane. He is a pilot, and so I got to go up in his plane with him recently, which I don't think I would have been able to do that before, definitely, because it's a little tiny plane. So, but
Dr. Hessel.
Yeah.
That's incredible. It must feel amazing. You have this, her brother said she looked like she was 10 minutes from death's door. She says she couldn't walk without a walker. She comes like kind of creeping into your office, and now she's flying in small planes, hiking with her son. Yep. That must give you goosebumps. It gives me goosebumps.
It does. It makes me really, really happy for Julie. We are so thrilled that she's able to do what she's able to do. But she put in a lot of effort for that too.
Team effort. Patient and surgeon, right?
Yes, absolutely.
Well, we know, Julie, you love Dr. Hessel. So we love bringing this next segment to all of our viewers because it's our viewers' chance to get to know our doctors on a little more personal level. So let's kick things off.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
This morning, we are going behind the mask with Dr. Hessel, who has a lovely family. Oh, and by the way, there are 2 surgeons in the family. Can you tell us about your second half?
Yeah, so Dr. Wessel actually is my husband, and he is a trauma surgeon here at the University of Kansas as well.
That's a lot of brain power in your house.
Sure.
And also, I kind of want you guys at every family function and party, because to have 2 surgeons at any party, nothing's going to go wrong that you guys can't handle.
Oh yeah, that's a lot of nerd. So,
a lot of nerd, a lot of brain. I want you to also tell us about your kiddos, because your daughters are so adorable. They look like dolls.
Yeah, so this is Brooklyn. She just turned 6 last week. And she was born when I was a resident. And then this is Austin, and she turned 1 in December.
I like her little onesie there.
Yeah.
Chiefs fans.
Chiefs fans.
Are they curious about what Mom does for a living?
Yeah, Brooklyn likes to talk about it a lot. Austin is more concerned about, when is Mom coming home.
Right. Do you think Brooklyn might be a surgeon in the future? Does she like to play on dolls and pretend she's doing surgery and stuff?
She likes to look at some of the weird pictures that come up on our phones that have to do with our operations and stuff. So
that's kind of cool.
Maybe.
And you also like to go hiking too, like Julie.
Yes.
You guys do hiking trips. Where are your favorite places to unwind, and where are you here?
So this is last summer when we went out to Steamboat, and we hiked Fish Creek Falls out there, and Brooklyn actually hiked like 7 or 8 miles that day, and then hiked another 7 or 8 miles the day after that.
As a 5-year-old?
Yeah, she was 5 at the time. Yeah.
And you guys carried the baby on your backs.
Well, yeah, my husband did most of that.
That's wonderful. Dr. Hessel, thank you for sharing your family with us and taking the time from your schedule to come here and educate us and our viewers. And Julie, thank you for sharing your journey with us. We're so happy to see you. You just look amazing.
Thank you.
And thanks to our viewers for joining the conversation this morning. We have a great episode planned next week as well on All Things Heart.
They did quintuple bypass, and I'm like, oh, like I hadn't even heard of that. I thought quadruple was like the most you could do.
Nope, quintuple is what this local drummer got. You know, he skipped taking care of the most important beat. His heart landed him in the OR, the emergency that brought him to the University of Kansas Health System for quintuple bypass surgery, and you'll meet the surgeon who performed that. That's coming up next Thursday on All Things Heart at 10 a.m.